The NDP government tabled its speech from the throne yesterday, laying out its blueprint for the next year. One of the announcements made includes the government wanting to ban employers from requiring sick notes from workers who are absent for fewer than 7 calendar days. Joining us now with reaction to yesterday's speech from the throne is Doctors Manitoba President Dr. Nichelle Desilets. Good morning, Doctor.
Good morning, Rochelle.
Thanks for joining us. Now, you were really paying attention to the speech from the throne yesterday. What were you looking for?
So doctors are looking for the government to make a continued commitment to the number one priority of both doctors and patients, and that is healthcare. We had hoped to see a broader commitment to extend the successes that have been achieved over the past 2 years in terms of physician recruitment, but also to spread that and not forget about the retention of the physicians that we already have.
So out of the announcements you heard yesterday, how do you think the province did?
There's a few ways to retain doctors. One of the ways to do that is to reduce their administrative burden, and sick notes falls under that. We launched a campaign about a year ago, including a public campaign, and we've consulted with various stakeholders, including the employers, unions, HR experts, the public, as well as physicians, and everyone came to the consensus that low-value sick notes used to attest to a self-limited or mild illness are not a great use of the healthcare system and don't add any value to patients who already know what they need to do in those circumstances. So this is a great step forward on a path to continue that reduction of administrative burden.
And it looks also, the province announced a ban on mandatory overtime for some nurses. What does that mean to doctors?
Well, doctors work in teams. Ultimately, we're responsible for what happens to the patient, but we rely heavily on our teams, and that means having nurses at the bedside. I'm at work right now. I'm about to go into the operating room where I can't do my job without my team of nurses. And so I want my colleagues to have scenarios where the workplace culture is good, where they want to go to work. So anything that improves those things is a win. However, I do recognize that mandatory overtime in the past and double shifts has come from a need to maintain services. I work in a really small hospital, and I really care about making sure that services and the ER are open when patients need it.
Also, a Charter of Patient Rights in Healthcare was also announced, along with a new online portal for patients to access lab results. What do you think about that?
That's really exciting. Manitoba lags behind other provinces when it comes to making patient information available to the patient that owns it. So I'm really excited about this, but we just learned about it yesterday, and I hope to learn more of the details. For example, as a physician, I can't even access some of a patient's medical information, medical notes, things like that. So there's clearly a lack of infrastructure and technology to make that information available if those within the healthcare system can't even access it. So I think there's technological improvements that we can make across the board, but this is a signal to me that a patient-centered direction in this matter is being taken, and we're all going to benefit from it.
So overall, you are pleased with some of the things you saw in the throne or the speech from the throne, but there could be more room for improvement.
That's right. I mean, all of the things that I've heard that pertain to physicians and healthcare, I think are positives. But like I said, we haven't heard the details yet, and we're really excited to continue the collaboration that we've made with the government. They took our advice on sick notes, and we appreciate that. And so hopefully that sets the tone for future relationships going forward, working out some of the details on sick notes, on how to handle mandatory overtime, the things that affect doctors' work every day.